In Paris, as we heard earlier in the show, Vice President Kamala Harris was in Chicago today to discuss vaccine equity with Mayor Lightfoot and other public officials. In recent months, the number of black and brown Chicagoans who have gotten the vaccine has expanded significantly, in part through the city's priority zip code program. But hurdles remain in getting shots to every community, especially as COVID-19 cases are once again on the rise in Illinois. Joining us now is Mercedes Carnafon, an epidemiologist and vice chair of preventive medicine at Northwestern's Feinberg School of Medicine. Mercedes, welcome back. Thank you. We've seen this surge in COVID cases in recent weeks. How much of a threat does this pose to the vaccination efforts in Illinois and across the country?
What this does is it really emphasizes the urgency of the vaccination efforts. We are facing rising cases after a few months worth of declines, and that is due in part to people circulating more. More things are open and places in which people will congregate. We need to stay on top of these cases by keeping up the pace of vaccination.
Now, as we mentioned, Vice President Kamala Harris was in Chicago today to discuss vaccine equity. Have the city and the state done enough to make sure that there is a level playing field there?
I really think that the zip code program was solidly based in science. There have been recent reports to suggest that vaccination by zip code, where we see clusters of cases and clusters of cases as well as the most severe outcomes, is a good strategy to reach those who are going to be the most affected. And in this city where we have certain racial and ethnic groups clustering within those zip codes, this also does a dual job of promoting racial equity in vaccination.
Now, for a long time early on in the vaccine rollout, we heard and spoke a lot about vaccine hesitancy, especially in the black and brown communities. But we're hearing some information that those attitudes are shifting. What do we know about who is hesitant to get the vaccine?
We have seen extreme improvement in the numbers of Black and Latinx community members who are willing to be vaccinated. And part of this is this snowball effect, right? So somebody's grandmother was vaccinated and they were fine. Another young adult is vaccinated and they speak positively about the experience. So all of those are real benefits, but the barrier we still face is how an individual secures a vaccine appointment. I think we still face inequities in the ability to snatch up this very scarce resource of getting that vaccine appointment. And when we rely on telephone and internet-based scheduling, that actually rules out an entire population who's not comfortable with those methods.
And you just talked about this a little bit ago, that Chicago earlier this year launched the priority zip code program to address that disparity in who's getting the vaccine. And you say that it's based in science. Tell us a little bit about the impact of that program.
Yeah, so what's happening is the zip codes where we see a concentration of cases, those zip codes, individuals who live in those zip codes are eligible for the scarce number of slots for vaccination, because we certainly are still seeing that demand for vaccination is outstripping supply. So if we're able to reach people in those neighborhoods and specifically invite them, we have an opportunity to reach out to communities who are hardest hit. And the science suggests that this is a very good way when we get to these community-based vaccinations to try to stop the harm that's being done to those communities that are hardest hit.
So President Biden also today, he has moved up the deadline for all Americans to be eligible. Here's what Mayor Lori Lightfoot said about that today.
The president has now moved up his timeline from May 1st to April 19 for all adults in the U.S. to be able to have access to the vaccine. We will meet that deadline. We need more vaccine from the federal government, but we're optimistic based upon conversations that opportunity will happen.
The mayor saying we need more vaccine and millions of people will soon be viable or vying for a vaccine. Mercedes, what hurdles remain in making sure that vaccine access remains equitable when everybody is able to get it?
I touched on one before, which is that appointments need to be made to secure the vaccine. However, the introduction of the one-dose Johnson & Johnson vaccine, which doesn't have storage requirements that are quite as stringent as the original two-dose vaccines from Moderna and Pfizer, means that we won't have to defrost a certain number of vaccines and prepare them and ensure that we have an arm to stick them into before we start out. What it means is that with this one-dose J&J, which is more stable, we can bring it to people in communities and be able to reach out. And those are ways in which we can get to some of those hardest hit communities.
Now, several weeks after Illinois and Chicago reopened bars, other public spaces earlier this year, cases began to rise again. Are we reopening too soon and expanding that reopening too much?
You know, it's a real challenge, and I am very sympathetic to the economic strains that the mitigation measures have caused for many communities. And it appears that we are balancing the risk and reward. You know, if we keep businesses closed, individuals lose their livelihood. But when we reopen those businesses, it serves as an endorsement that it is safe for people to congregate together, and that is not the case. What we're seeing is a rise in rates in young adult populations, and these young adult populations are only now eligible for vaccination. So what we saw happen is what we could have predicted, and it's a very hard thing to see because as a result, our case rates are going up, and the lagging indicators such as hospitalizations and deaths are likely to follow. But we have these balancing economic as well as public health concerns. And right now, I think we're walking a really tough balance.
Okay, I'm sure it'll remain tough for some time to come. Our thanks to Mercedes Carnathon for joining us as always.
Thank you very much.